another episode of Dojo Live. Today is Thursday, October 21st, 2021. I'm Tulio Serdusa, broadcasting from Southern California. Joining me today are Carlos Ponce in Cuernavaca, Mexico, the city of eternal spring.
Yes.
Welcome to the show, Carlos.
Appreciate it.
And
Thank you.
joining us from Pittsburgh, Pennsylvania, a beautiful sunny Pittsburgh, Pennsylvania today, Michael Wood with Insighting Health. Hi, Michael. Welcome to the show.
Hi, guys. Great to be here.
So
Absolutely.
we're going to be having a very good conversation today about healthcare. And before we get into the topic of conversation, let's get to know you a little bit. You're the Chief Strategy Officer at Insighting Health. Tell us a little bit about you, Michael. Please introduce yourself. And once again, welcome to the show.
Thank you. I've had a kind of interesting background to get to where I am today. I started off I've always had a passion about change, always from being a kid. I've always enjoyed kind of futuristic things, and especially when that comes to innovation. And so I think that's always been kind of something I've enjoyed throughout my career, is the ability to kind of look at the future and change things. And that's kind of been, a passion of mine from as I said, an early age. I think how that's translated throughout my career is that I've done a lot of different kind of things if you look at job titles, but actually really what it boils down to is transforming something from one state to a better state, and bringing along the people as part of that journey. That's often an overlooked area when things are either growing, scaling, transforming, is how do you actually, handle the human change elements of that. So that's something I've always had a real passion about. And with that kind of futuristic kind of view, but also, knowing how the nuts and bolts fit together on a daily basis, I've been involved in some pretty interesting, engagements. And that's varied from, in the UK, I was a public servant for many years and dealt with their kind of large scale public services transformation programs, which at the time were huge. And when I emigrated to the US in my 30s, I got involved in healthcare, which, again, an industry I knew a little bit about, tiny bit. And that's evolved since I've been here. So that kind of ability to work across industries and tie things together as well, from not only, providing that different perspective. So obviously I bring a wealth of UK experience and European experience in as well. So that's the kind of the more professional journey. In my spare time, I'm a huge fan of Nottingham Forest. I aren't a Premier League team, but they're almost there. They're very big in the 70s. So yeah, that's my other vice when I'm not working.
Nice. Thanks for joining us today, Michael. Tell us a little bit about your company, Insighting Health. What gave birth to the company? What was the idea behind it? And what is it that you guys do today?
Well, again, it's an interesting kind of story there for me personally, because it stemmed from I worked for an insurance payer health plan here in Western PA, and I worked as part of their quality organization. And at the time, that was kind of at the beginning of the ACA, the inception of the ACA. So it was changing the organization from that kind of fee-for-service traditional model into more of a value-based care model, and really setting the company up for success in retaining and achieving those kind of quality bonus payments. So with that background, we were very successful in that engagement. And as part of that, one of the things that we built was a tool, basically an IT tool that would look across the organization and provide information and educational points for people who called in. So members who basically called in and wanted a bit of information. How could we change that conversation from more of a reactive, hey, I've got a question about my bill, into, hey, are you getting the right preventative care that you need? and changing that more into a kind of an educational opportunity, and an opportunity as well just to gauge the pulse of the member. How are they feeling? How happy were they? Now we're talking 8-9 years ago here, and actually what led me to my current role was our vendor that we used to build that, what we call the gap board, is our founder and CEO at Insightin, Enam Noor. So I work closely with Enam on building that technology, and he and I saw things very, very similarly in terms of we understood what healthcare was holding healthcare back from being a more optimized industry wasn't a lack necessarily of data, it was a lack of usability of that data and also timeliness of it. So that one piece of work that we did there, that led into the product we have today, the Engage platform, which aims to connect that ecosystem, that whole member journey, from the point of view of I want health insurance or I need health insurance, what are my options, right through to, okay, I need a new plan. How do I find a new plan? Now, in the middle is where the messiness happens, because really what you've got there is a lot of different organizations who are, providing the member with various parts of that journey. And a lot of the time that's disconnected. Even with the health plan, that's totally disconnected a lot of the time. So what we do is we aim to make sense of that, by providing that data that kind of joins the whole system together, or the whole ecosystem, so that you can see basically what's happening elsewhere within that member journey, and then you can be more informed when you have a conversation with that member and build their trust. So that's kind of how we came to be. That was back in 2017. I was employee number 2. So it was,
Wow.
very, very early stage. And at that point, we had one contract, one client. We've grown in revenue. I think 170% growth year on year. We're now cover over 5 million lives in the platform nationwide in every state. And we've got an 18% market share just in terms of, members today that are on the platform. So it's really grown from that very first kind of idea to where it is today. It's been rapid and exciting.
That's great.
Congratulations. Congratulations.
Yeah.
All right, let's see what we can learn and unpack today. Carlos, would you please introduce the topic and the question we're going to try to answer today?
Of course.
Let's get right into it.
Of course, thank you, Tulio. And of course, thanks, Michael, for being with us today. So today we're going to be answering one question. That question is, how can AI and predictive analytics directly benefit the individual patient? And to answer this question, Michael has chosen as a topic for today's conversation the growing consumerization of healthcare, as this is the topic is chosen by Michael. First question that I have for you, Michael, is why did you choose this particular topic for today, and why did you feel it was relevant for today's day and age? Let's start from there, please. Thank you.
Okay, so there's a couple of things there that I think are important factors. The first one, I think, is that the demand from consumers themselves, so healthcare consumers, are that they want a simple and a more transparent experience. They want to trust what their health plan tells them, and they really want that kind of that ability for the health plan to guide them along their journey. I think that's the first change. So the industry is kind of ripe for that change right now. You've seen other industries go through a similar transformation, whether that be retail or fintech, and healthcare now is really adopting a lot of those different innovations from those industries to drive that kind of next level experience in healthcare. Now, the other driver to this as well is, we talked about the ACA a few minutes ago, and when that was first adopted, it focused very much on raising the standards of preventative care. Obviously, with the theory being prevention is cheaper than cure. What's happened as an evolution of that program is now the way that quality bonus payments are going to be structured, the way that basically plans are going to be scored and measured. A lot of that is going to come down to the experience that the member has with their plan. And so in order to understand whether that's a good experience today and to build that experience of tomorrow, plans really need to embrace that as a concept that basically, gone are the days of consumers accepting that their experience is going to be disconnected. So those two things, I think, are big drivers behind the change. So basically the way it's funded and the quality side of it, and I think just basically market demand has led to that.
Okay. Before I pass it on to Tulio, thank you. First of all, thank you for answering for introducing the topic. I would like to ask you, for those who are watching who might not have an exact idea what it means, would you mind explaining what does the consumerization of healthcare mean, or what are you trying to imply about the consumerization of healthcare?
Yeah, it's a simple concept if you apply it to our everyday life with, for instance, Amazon. We all shop on Amazon today. Well, with Amazon, there are certain things that we expect. For instance, we expect a simple way of shopping. We also now, as part of our everyday lives, we expect recommendations, reviews. If there's a problem, how do we do that seamlessly? And how do we tie all that together? So I think in terms of, if you're seeing it in other industries, I want my healthcare to be like that, basically, as a consumer. I mean, part of my passion here as well is when I moved to the States, I found the healthcare system probably one of the most confusing things to interface with. It was just, and even when I rang my plan, they couldn't tell me what I need to do next. It was almost like, the blind leading the blind. And so at that point, I think just being able to help people navigate a very complex thing. And
just 1 second. Sorry about that.
No
Sorry about that. I need to mute all my devices. Okay.
That's it. Lesson learned.
Yeah, lesson learned. Exactly. Sorry,
I thought it was time for a commercial break.
No. Let's just.
Time's up.
Not really.
Time's up. It's a game show.
Yeah, that's what makes it human. It makes us human. Okay. Anyway, I'm sorry.
Exactly. So yeah, I think we see that every day with Amazon. We also experience that with even things like Netflix and entertainment, where if you watch this, then this might be the next thing you want to do. So why should healthcare be any different? And I think consumers are really, that's the experience they're seeking today.
It's an interesting dilemma, to say the least. I remember years ago when companies were trying to improve their customer success or customer service functions, they would often look not to other companies that they were competing with, but they would look to some of the leading companies that were well known for creating exceptional customer experiences. At the time, for example, I'm dating myself 20 years ago. At the time, for example, American Express was known as providing exceptional service. So if you were a telecom company with large customer call centers, you want to model yourself to create that kind of experience. And then obviously that has evolved today to more self-service. We've moved away from calling and going into the branch or what have you, and everything's online. So everyone's been turned into an employee today, right? And self-service is always good service because you're the one doing it. But with that comes new challenges, right? How do you create a satisfactory experience, or, and the gold standard to a lot of people for what it looks like online is like, their experience with Amazon. So I rightfully hear about that example. When it comes to healthcare, it has been messy and complicated for most consumers. So how does this help make that shift And how do the consumers benefit from it directly? Do they get to participate in this process? Do they have access to these tools, or is it only for the companies that license this technology, this platform, that then enables them to provide a better service to those end customers? How does it work specifically?
Yeah. So today it's primarily B2B. It is B2B. So it's, the payers, the health plans are using this tool internally to help connect those different verticals or those different branches of their organization together. I do see a future where, that could be obviously, a member facing, solution. And just some health plans, not all health plans are kind of, coming out of the dark ages, as it were. There is a lot of innovation out there, and I think some of the plans that really invest in that experience and they invest in tooling today, those digital tools to help their members, I think they're the ones that are going to benefit from the changes in weighting that make it more difficult for those other ones to reach those kind of quality standards, as it were. Now, I know you had another question in there, and I lost it. So, what was the other point?
Well, I'm just curious about how the consumer participates, right? So, how does the provider learn what is sort of next? Because I'm hearing you introduce this idea of the customer life cycle, which is very common for retailers.
Mm-hmm.
And there's tools and all kinds of AI technologies to enable that. But in healthcare, how does that work? Like, how does a provider or healthcare or insurance provider know perhaps or predict that maybe I'm going down the path of developing diabetes and there's some preventative things I ought to do? How does it figure things like that out? Because it's a little bit more personal. There's HIPAA, there's all these other compliance challenges. So how do you crack the code on that to involve the consumer in that process?
I think it's a number of things. I think, first of all, we talked about a few moments ago, we talked about the fact that healthcare as an entity doesn't lack data. It lacks actually joining that data together into making it into actionable activity. So when you look at that, a lot of the data that you're talking about, for instance, if somebody is showing a trend towards pre-diabetes, for instance, at the moment, your health plan is probably, unless you've either answered a direct question or you have visited the doctor recently, the health plan's probably unaware of that. Okay. Now, where I think technology like ours helps the health plan is that we look deeper than just what's happening with, we look into the activity. When the member went to the doctor, did they provide, any kind of feedback? Were they satisfied with that visit? Was there a problem? Are they calling into member services? Do they have any concerns? Are there things that we know from the data that we have? And also looking at other groups or other personas that look like that member, are there things that other people are experiencing too, and they're likely to be happening to this member? This is where, some of the advanced kind of machine learning AI kind of comes into it, because really at that point you're starting to say, well, look, I'm having a conversation with this person, and all these different attributes, I'm understanding them as they come in, and as they come in, they're changing what that conversation is going to be, depending on the, how good is that data, how reliable is it? All those different models that basically say, okay, if it reaches a certain percentage, then that's probably a good, what's the word? A good benchmark. And obviously, healthcare, they need to be high.
Does it bring in the
Michael,
I'm sorry if I could just do one more follow-up.
Oh, no, yeah, please.
Does it bring in the practitioner as well, the healthcare provider? So, for example, a study was done long ago that showed certain patients that were doing aspirin therapy, who had heart conditions or cardiovascular issues, had less reoccurrences of being, ending up in the hospital than those that were not on aspirin therapy. So does this kind of insight help also the practitioners perhaps get, be able to provide better care to their patient through examples of other patterns? How do they get brought into the process?
So yeah, actually, yeah, there's a great practical example there, and that is, yes, they basically, if you imagine, everybody who's connected to that member journey has their view of not only what they are doing within that member journey, but also the things that are either side of it. So, a simple example and a valid one there is, okay, somebody goes in the hospital for a particular, treatment, and they get discharged. Well, one of the things that you want to avoid is a readmission. That's a target that you want to keep low. You don't want to have many more readmits because it's more expensive. It's also showing that somewhere along the lines that post care hasn't worked. So if you look at that just as a series of almost like gates that the member goes through, you've got that, okay, when they leave the hospital, did they get their discharge papers? Did they get the right pharmacy information? Did they get, were they provided, for instance, with the right contact information? If they had a problem, what were their escalation routes? Those kind of things. When you start to then be able to say to a member, okay, this is what's going to happen. Now, if any of these things that we're tracking suddenly go off the rails, so for instance, if they had a heart monitor, once you start to see those things, that's when you can ping the provider in this case and say, hey, that patient that, Mrs. Smith that got discharged last week, she's now actually got a temperature, and she's kind of got some elevated levels. We might want to consider an outreach to her. That's much more proactive than it is today, where the doctor a lot of the time only knows that you've been in the hospital, like when you show back up at the surgery with a bag full of meds that you got from the hospital, and you need everything resetting. So that's a good that's a good kind of example there of how you can bring in the providers.
Michael, we're discussing in greater detail the numerous aspects of what inciting is about, well, the AI and the tech component at a very, very fine granular level, which is very interesting for a lot of people. But if I were to ask you let's call it from the humanistic standpoint, and broadly speaking, would you say that in these matters, healthcare, AI, would you say that we're witnessing some kind of digital transformation of
Oh
the
yeah,
doctor-patient connect, or not
everything.
really? What do you
Yeah.
think?
No, I think everything. I think as well as that, there's obviously the this year's kind of elongated episode of the pandemic that's changed everything too. So yes, it's changing things both clinically, artificial intelligence in particular. You're seeing things like radiologists, for instance, and radiology departments in effect, they won't be around in a few years, because AI has now got to a level where they've proved that they're more accurate than a radiologist, and you can get instant results. So you're going to see less of those traditional kind of roles, and more on the making sure that, again, going back to those kind of benchmark standards, that's where you've got to put a lot more into making sure that the model is as accurate as it can be, because again, you're talking about health. So we all want to know that, yes, my x-ray's been checked and it's 99.9% accurate, whereas if it was being looked at by a human, it would, might be only 90%. So that's, I think, in terms of, that's one side of it. Then I think in terms of how you actually interface and interact with your health, I think as a consumer, that's going to change. The current administration have said by 2030 they want a primary digital experience for healthcare. So you're seeing both clinically things change, operationally things change, and I think even on the consumer side, you're seeing things change. And yes, it does change the relationship with your doctor, where that traditional face-to-face, it's
Hmm.
not as as important as it used to be.
Right, right. Okay, yeah, I have one more question and then I'll pass it on to Tulio. Okay, again, we're discussing how to directly benefit the individual patient, right? So, in that sense, would you say that things like AI and predictive analysis could contribute at the preventive level at some point instead of fixing things like, oh, I'm broken, I'm sick or whatever. Now I'm gonna heal through AI, or AI is gonna help me. Can this work at the preventive level? And if so, how would this happen?
I absolutely is the answer, and I think a great example of that is actually diabetes. And if you look at it, the treatment of diabetes is the treatment of diabetes. Without a cure, it's still going to exist. So
Mhm.
that's where I think you can start to actually look at how can we fully scientifically kind of pin the nail on the, this is about diet, and it's about other things that actually contribute to us in later stage life developing, either type 2 or type 1 diabetes. I think you can definitely use AI and the power of AI to not only look at some of the the symptoms and the drug benefits and things like that, which I think can really be supercharged with AI. I think the other thing that you can look at is those root causes and really come back to, okay, if we fix this in 40 years, we're not going to have this problem. Now that's a difficult sell for people who aren't playing the long game. Um,
Hmm. Right.
but at the end of the day, that to me is where the power of all this great technology, that's where it can really come into its own, that it can actually stop these issues at source
Hmm.
rather than it just being, hey, we've developed this pill that's great, but it's not going to actually, it's going to make you feel better, but it's not really going to ever solve the problem. So that's more altruistic on my
Okay.
part. That
Yeah,
I
yeah.
see that. Um, yeah,
What are the challenges with that? I mean, when it comes to medicine, it's predominantly post the problem, right? When it comes to alternative medicine, that's predominantly what people use for preventative purposes, whether
sure.
it's holistic approaches or chiropractic, vitamins, herbs, what have you. There's a number of different ways to prevent disease and to stay healthy, but it's not always recognized as an effective approach. And yet you have countless cases of people that will swear up and down about uh, their favorite vitamin or what have you, or
Sure.
supplement that helps them avoid a fatty liver, for example, right? Milk thistle, for example. But
Yeah.
that's not recognized as a medical type of treatment. So, what's the sort of challenge here between marrying medicine to deal with problems and get more effective at doing that and supporting patients better in doing that, and also prevention, which is not always tied to medicine? As you said, it could be diet, could be lifestyles, could be
Yeah.
supplements and things of that sort. Where do you see the challenge and the opportunity there to bridge these two sciences that sometimes are mostly at odds today? At least here in the US, they're at odds.
I think it comes down to choice. I think that's a good way of tackling that problem. In the as a member, I want to have the choice. So yeah, if I hurt my back, and it's a poor example, but if I hurt my back, I might not want to take a pill, but I might want to go to either a chiropractor or to an acupuncture clinic, for instance.
Mm-hmm.
I should be able to be educated on the best one of those for me and my circumstances, but I should have that option. Um, again, it comes down to choice. So I think expanding the choices that people can have within their plan benefits, I think is one way that it could be tackled. And again, there's I often look over to Europe for some of that kind of thinking too. And in Europe, holistic medicine is much more accepted and
Mm-hmm.
much more common. And so I think again, as an industry, as a administration, overseeing body, whatever, I think we have to be more open to the fact that people do have different lifestyle choices, and at the end of the day, as long as they can take the path they want to take, I think that's good. And one of the risks there to that is obviously privacy and data. People are already, everybody is concerned with, security. But I think when it comes to your healthcare in particular, it's one of those things that you wouldn't want that falling into the wrong hands. So I think that being able to explain why you need maybe a piece of data or how that's going to improve, if you tell us this, we'll be able to tell you these things. It's a bit like, what you see on the Ancestry app. I know that when I did my DNA swab there, I had to, then there was like, questionnaires, and they were all trends or traits to do with, my DNA. And just be answering those questions actually narrowed it down much further. So I think, some sort of process like that where, and it comes back to putting the power of this in the consumer's hands. I think that's where it ultimately needs to sit, because that's the only way that you'll get mass adoption and trust, which is the most important thing. It's that's always a bit of a thorny wicket to kind of bat on.
Yeah. Well, it sounds as though we have a long way to go, but technology can certainly help bridge the gaps, and hopefully we can learn how to create a hybrid type of approach to healthcare, not just a one or the other. So thanks for being with us. We're out of time. Thanks for being with us today. We
Pleasure.
really appreciate it. We wish you continued success. This is definitely something that's needed. I certainly want to have access to it. I want more control over my healthcare and what happens. And so I'm sure there's millions of others who feel the same way. So
yeah, me too.
Exactly. So it's good to know that there's companies working on making that possible and democratizing where appropriate the healthcare. Thanks for being with us today. Stay with us as we go off the air in a minute. Join us back on Monday at 12 o'clock Pacific as we do the recap show. We will recap 3 live shows from this week. And what do we got coming up in terms of guests for next week, Carlos?
Sure. We got 3 shows, Tulio. We got a full week ahead. On Tuesday, we got Unum ID, EUNUM ID. And then that is a passwordless identification card, which I don't have the topic yet, but should be as interesting of all of our Dojo Live interviews. And then on Wednesday, we're going to be speaking with, we're going to be having, sorry about that. I lost the thread here. Dave Landa at Kintone. That's on Wednesday. And finally, on Thursday, we're going to be speaking with Anthony, Anthony Molson at I'm sorry if I mispronounce it, Aegis Flow. So that's what we have for next week. We have a full week ahead. So everybody join us right here on Dojo Live. Don't miss any of the shows. And remember,
stay safe.
Stay safe.